Assalamu alaikum dear students, welcome to my channel MLT DEC0DE. This is the General Pathology playlist and the topic is the cellular adaptation. So what is the cellular adaptation? Cellular adaptation, by definition, we tell that cellular adaptation is any change in the cell when stress is applied, and the change may be change in the size of the cell, in the number of the cell, in the phenotype of the cell, and in the metabolic activity of the cell. So why cellular adaptation is very important? So I give you some example about the cellular adaptation. The first one is that a chronic smoker, suppose that a person is a chronic smoker and in his lungs there is normally respiratory epithelium is ciliated, columnar, in the columnar epithelium, but when they chronically smoke, this epithelium change into the squamous epithelium, which do not have cilia and which do not work very properly. And the other example is the acidity in the stomach. When your stomach acid go up to the esophagus, there is the special cells in the esophagus which is the squamous epithelium, which change into the intestinal epithelium, and the intestinal epithelium contain mucus cell, also goblet cells, which is, and this is the another example. So there is many examples. They are the, so I decode first the definition. The change in the size is the size. By size there is hypertrophy, and I also tell you about the hypertrophy and the number. We, if the cell number increase, we call it hyperplasia. What is the phenotype? Phenotype means that the cell change its whole structure into another cell. Means that in the, I take example of smoker which have columnar epithelium, but due to smoking this change into squamous epithelium. So a person change its a cell changes whole structure. This is the phenotype. And the metabolic activity. Metabolic activity, you know that when there is less oxygen, then our glycolysis pathway, which is usually a oxidative pathway, but when oxygen is low, there is non-oxidative pathway involved, and the end product, which is normally pyruvate, this is not pyruvate, it is lactate, and the lactate accumulate in the muscles and the muscle become fatigued. So this is many examples. So learn what is the hypertrophy. Hypertrophy, in which the cell size become increase. Size is the cell size become increase, or you call it cell become a hulk. Cell become hulk. You see in the Hulk cartoon, so that I am writing increase in the size of the cell, means increase cell size. So if the cell become, normally the cell is dead, this is a smooth muscle suppose, but after the hypertrophy the smooth muscle become this like giant Hulk cell, right? So they are the two type of the hypertrophy, which is the physiological and the pathological hypertrophy. So what is in the physiological hypertrophy? The first example I take you to physiological hypertrophy is the bodybuilders which have huge muscles. Where these muscle come from? The muscles are the skeleton muscles, and the skeleton muscle increase their size. When they increase the size of the skeleton muscle, they become hypertrophed. Because hypertrophy, because their work is more, we require more work. Where from this come? From the cell. And why cell do this? Because there is more actin and more myosin and more myofilament in the cell, more mitochondria in the cell. Mitochondria number also increase because we require more energy. There is very special point in the lecture that why skeleton muscle do not undergo hyperplasia, because you see that the bodybuilder have very huge muscles. So why don't hyperplasia occur? The cell increase their size. Why do not cell increase their size and there is only cell become like a Hulk, or they become large? Because the skeleton muscles are non-dividing cells. They do not divide. Because they do not divide, so they do not become hyperplasia. They only do that they become Hulk and they increase their cell size. So that this is the mechanism. I write there that the skeletal muscles Which type of cell are these? They are the non-dividing cells. Remember this point, they are the non-dividing cells. Another physiological example that I give you, it is the breast hypertrophy. Breast hypertrophy. Why this happened? You know that a female after menarche have a menstrual cycle which has two parts. The first one is where is the estrogen level increase, and the second part after ovulation the progesterone level increase. So when there is estrogen level increase for up to 14 days, maybe 14-day ovulation occur. So because estrogen do what? It increase the fat in the woman. So when there is increased number of fat, the fat accumulate at the site of the breast, and the breast increase its size. So there is hypertrophy of the breast also occur. This is the example. But the breast do not only alone do hypertrophy. It do two things: hypertrophy plus hyperplasia, which I will tell you in the next lecture. Another example of the physiologically hypertrophy is the uterus during pregnancy. You know that the uterus womb is present in the uterus, so the uterus increase their size. Uterus size increase in pregnancy. Why this happened? You know that there is that this is the uterus and this is the vagina. This part is the cervix. There are three layers of the uterus. I shown here that there are three layers of the uterus. This one is the myometrium. Myo mean muscles. Okay, myo mean the muscles. So this is the layer where the smooth muscles are present. So in the pregnancy, you know that there are many hormone increase. The main one is the progesterone and the estrogens. So they can hypertroph the smooth muscle. This is the innermost, which is the endometrium. This is the outermost, which is the perimetrium. This one is the middle layer, which is made up of smooth muscles, and this is the myometrium, which in hypertroph and the uterus size become increased. Why this increase? Because the womb is present, fetus is present in the uterus, right? This is the fallopian tubes, and there is the ovaries. I don't draw that because this is important. So this is the physiological mechanisms. Now I told you about the pathological mechanism, how the pathologically hypertrophy occur. The one of the most important that you should know is the myocardial cells. The myocardial cells, which are also called the myocytes, right? And these are the fibers which become hypertrophy in many conditions. The one of you also remember that the muscles in the myocardial heart and the skeletal muscle, they are the striated muscles, right? And the heart muscles are intercalated muscle. You know that heart muscle are intercalated muscle. They work together like intercalated manner. So what kind of stress that occur? Because cellular adaptation by definition is stress applied on the cell which change in the size, and the size is the hypertrophy in the manner. So they are the two important stress that should hypertrophy the myocardial cells, and these are the first one is the very important hypertension. Hypertension is the most important, and the second one may be the valve defect. I tell you these in the detail. So this is the, you see that this is the left ventricle and this is the left atrium. This is the aorta going down, right? This is the bicuspid valve and this is the aortic valve. So you know that normally blood enter to the right atrium and then to the left atrium, then to the left ventricle. Now this is a normal, and then it go to the aortic valve, and by this aorta go, and there is very normal flow of the blood. So the normal blood pressure is the 120 by 80 millimeter of mercury, right? This is the normal 120 by 80 millimeter of mercury. But what happened in the hypertension, this is not 120, this become like 160 or 180 or that. So what happened next? The vessel become more narrow when the pressure is increased. The vessel become like this. See, vessel become more narrow. So this is the normal vessel aorta, and this is the these are the arteries which become narrow. So when blood has to pass through this narrow vessel, the heart has to pump very strongly to put all the blood each beat to pass through that. So when the hypertension increase, the pressure in the vessel increase. This pressure is put pressure on the heart to work more. How heart work more? Heart become hypertrophied. Heart muscles do not divide. If they divide, they become also hyperplasia, but they do not divide. There is only hypertrophy of the cell. The heart muscles become enlarged, and when they become enlarged, there is an increased muscle fibers also. There is increased actin and myosin, which is the myofilaments, and their hypertrophy also mitochondria increase, and this lead to the heart cell become like a hulk. And when they become like a hulk, they more strongly contract, more blood go, and the heart keep it up with the hypertension. Another example is the valve. You see that there is the aortic valve and there is the bicuspid valve. Normally blood go and all these occur, but when there is the infective heart, for example there is a valve defect or valve regurgitation, or there is an infective endocarditis, the heart valve become weak. Blood normally flow from the left atrium to the aorta, but then when the valves become closed, no blood can move back. But when there is defective valve, suppose that this is the closed valve is closed, but because this is defective, it does not close properly. When the blood come back, it re-enter the left ventricle. When it re-enter the left ventricle, the heart will pump with the new blood which come, and this blood which he also pump out, it come back, and new blood and the backup blood both are then in the next beat go out and pass through the aorta. And if there is hypertension also, there is many problems. The heart become hypertrophied, and there is the pathological hypertrophy which become by the hypertension and the valve defect. Now I will tell you how does the heart look in the X-ray. When you see the heart, it become like normal heart, but it become like this. Heart become like this, and in the inner it also decrease in the diameter. So from this to this, there is the hypertrophy of the heart. And when you do a biopsy or you take a heart in the person who had died due to the hypertension or valve defect, there is must be the hypertrophy that occur in the heart. So this is because of the hypertension and the valve defect. The mechanism I tell you become see this, and there is the myocardial cell hypertrophy due to this. There is the also other myocardial, there are the other cells hypertrophy also, which is the other one is the prostate. How prostate hypertrophy? The prostate hypertrophy is called the benign prostate hyperplasia. Benign prostate hyperplasia. Why this happened in the old peoples and in the old, especially men's, if there is androgens level become increase. If the androgens increase, they bind their receptors in the prostate, and this lead to the enlargement of the prostate, and this mean block the urine flow. This also block the urine flow. So you see that there is the prostate hypertrophy, which is the pathological hypertrophy, and there is the heart myocardial cell hypertrophy, which is also a pathological hypertrophy. Okay, the next one hypertrophy we see that in the which take place in the hepatocytes. So in the hepatocyte, how the hypertrophy occur? Mainly we know that there is a P450 system. You know that this is a very important pharmacological point. P450 system is the enzyme that detoxify many drugs, which is present in the smooth endoplasmic reticulum of the hepatocyte. So when we give such drugs like alcohol, we give like barbiturates, these are the drugs we give, there is the increase in the size of the smooth endoplasmic reticulum. Why? Because these drugs use more enzyme, and for this reason the hypertrophy of the smooth endoplasmic reticulum occur. Because if the hypertrophy of this occur, the P450 system, the P450 size also, the enzyme also increase in that, and there is increase in the point, and this may alter the metabolism of most of the drugs. So when you give alcohol or barbiturates, these drugs can cause the hypertrophy of the smooth endoplasmic reticulum, and the smooth endoplasmic reticulum, there is enzymes the P450 system peroxidase, which have family of many enzymes. This also increase, and this may inhibit the many metabolism of the many drugs. Okay, cool. Now I tell you more about the myocardial cells, where how the hypertrophy happen in the six. You know that there is the normal myocyte. This is the normal myocyte. No stress is there, but when there is the stress, when the age of the person increase, there is increase in the stress. But is the stress, there is hypertension, there may be diabetes, or maybe valve defect, endocarditis, many things these are happen. So when stress is increase, so what happened, there is the hypertrophy of the myocyte. So what happened now in the hypertrophy, if the stress is not relieved by the drugs or by the management of the person, there is hypertrophy, and the heart cells become more hypertrophed, and one day at a point the cells become more increase their size. There is a limit on the hypertrophy, and because there is a point occurred that the cell cannot become increase their size more or become hypertrophied, the cell become die by a process which is maybe the necrosis or maybe the apoptosis, because there is many large size of the many increase in the size of the cell. So cell necrosis might occur in this patient if we do not relieve the stress. So these are the pathological condition: your myocytes, your prostate, which is the benign prostate hyperplasia, and the P450 system hypertrophy in the smooth endoplasmic reticulum hypertrophy also occur due to the barbiturates and the alcohols. And the most important stress is that the hypertension and the valve defect. Valve defect may be due to the infective endocarditis due to many bacteria present in your the bloodstream. Okay, dear student, now I tell you the mechanism that what is the mechanism behind the hypertrophy of the myocardial cell. This is very important. If the stress is applied on the cell, then the cell of the heart become increase their size or hypertrophy. Which thing tell the heart that there is increase in the pressure or stress is applied on me? What tell this? There is the some receptors on the heart, which the first one is the mechanical. The first thing is the mechanical. These are the some mechanical receptors in the heart. If the stress is increased, if the more blood is coming, or if there is more hypertension and the blood coming back due to the valve defect, these mechanical receptors tell the heart that please make more proteins, increase my size, I want to work more. So this is the one. What they do, they increase the transcription of what? Transcription of the protein. So if the transcription of the protein more, then there is increase in the, so if the transcription of the protein more occur, means transcription is the DNA convert into RNA. This is the transcription, and then transcription, there is the translation of many those proteins which increase the cell mass, or they are the maybe the actin or myosin. These are the myofilament acting on myosin. The other thing we see that there is the alpha adrenergic agonist. What are these? You know that in the pharmacology there are some drugs which increase the alpha receptor and they work as a agonist. So when there is increase in the alpha adrenergic hormone, and do you prescribe a patient a drug which increase the alpha agonist activity, there is an increase in the transcription of the protein, and this transcription tell the heart please make more and more protein, I have to work more. And the other thing is the insulin like growth factor 1. These insulin like growth factor which is normally secreted from the pituitary and their function